I mean, lying down on the operation table is not something everyone does during the course of their daily routine.
HIFU has been gaining a lot of popularities these days. So, how do you compare how HIFU versus facelift procedure?
Surgery is Mount Everest. Of course, I sometimes tell patients not to see too many surgical videos online.
Yeah,
The
that
main
is.
problem with
They keep on
patients is
googling it.
that they
Yeah.
keep seeing surgical videos, and that's what makes them feel scared.
And if you are someone in your 50s wanting to look like a 20-year-old, you can actually opt.
Sometimes you just need to trust the doctor and trust the process, and not try to over analyze or not overthink into what the procedure is going to do.
Hello everyone. Welcome back to new episode of Cosmetic Tales with Dr. T. So today we are going to talk about a very interesting topic, that is surgical versus non-surgical facelift procedures, that is HIFU versus traditional facelift. So we have Dr. Parag Telang who's going to answer all our queries. So the first question is, sir, HIFU has been gaining a lot of popularities these days. So how do you compare how HIFU versus facelift procedure?
Well, HIFU, I look at it as a procedure which is mainly for maintenance. Okay, so patients, when they ask me what is the appropriate age to do HIFU or how frequently they should do it, I normally feel that once you're beyond 35, nearing 40s, a little bit of laugh line coming
Right.
up and little bit of sagging in the marionette area, that is a good time to start HIFU. And I normally recommend patients to do it like twice a year. So that is for maintenance. That is just, you're trying to tide over the surgical lift. What will actually work on the face and actually make the face look tighter and younger is the surgical lift. So we really can't compare the effect of HIFU and surgery, because surgery is Mount Everest, and
Right.
you can't really compare with other treatments. But having said that, you see all the time that we have patients who hardly have any time. They are so busy with their daily routine, and surgery needs time. It is
Correct.
not something you can do when you have a wedding in the family or when you are having some important shoot or event. So for that category of patients, yes, you can do HIFU in the intervening period so that you look good for your big day. But then later on, of course, you need to plan and then work for the ultimate thing, which is the surgery.
So second question was that only, what kind of patient do you recommend HIFU for, and what kind of patient you recommend a surgery?
So I normally, how I do this is I ask the patients to stand in front of the mirror, and I ask them to just lift the face skin with a finger. If the skin accumulation here is more than a centimeter, then they definitely need to think of something like a surgery. If it is like few millimeter and not much of laugh line or not much of sagging in the face, then maybe they can go for HIFU primarily. Of course, age is not the only thing. We need to see whether a patient has had weight loss, or whether the patient has genetically a skin which is very thin and they're more likely to have early sagging. So depends on how much sagging the patient has. If it is less than a centimeter, HIFU to begin with. If it's more than centimeter, they won't be very happy with HIFU. So then maybe they are candidates who can start thinking about planning a surgery.
So are there any risk or complication associated with HIFU?
With HIFU, not really, because it's an external procedure, it is non invasive, so there are no risks per se. A few patients have had a bit of redness for 1 or 2 days after HIFU, and sometimes patients find it little uncomfortable. So, those who are sensitive to pain, we normally apply numbing cream and then do it. If someone has a dental filling, then that particular spot sometimes feels like a tender area when HIFU is being done. Apart from that, HIFU really doesn't have much of side effects.
So how many sessions of HIFU will you recommend to see a noticeable difference?
If someone wants to have a visible difference on the face or neck with HIFU, I would say do one, then do another one after a month, then wait for 6 months and then do the third one. Because by waiting for the intervening 5 months, you are allowing the collagen fibers to tighten. Because whenever we use a modality like HIFU, you are not controlling the tightness of the skin as a physician. You are just delivering energy to the skin, and you are dependent on the patient's skin to do the work. So you need to give it time to tighten up. Younger age group patients, they will find the effect much faster at an earlier date than a little older age group of patients whose collagen fibers are probably too much stretched out, and they need to wait on it for 6 months to see a good difference. But if you have to, give a timeline, I would say 3 weeks to a month is when patients actually see the difference of HIFU. What they see immediately after the procedure is maybe 30%. It improves over a period of a month or so.
Correct. And can HIFU be combined with other treatments like fillers, Botox?
It can, but then if you are planning to do fillers, then I would say first do the HIFU and then the fillers, because when the skin is tighter, the requirement of filling is that much lesser. Botox does not have that much of interaction with HIFU, so you can do both on the same day as well. But the sequence is always first lifting and then filling.
And when would you advise a patient to skip on HIFU and directly go in for a surgery?
If a patient is, say, already nearing a 50 kind of age group, and or they've had a lot of weight loss, and there is really a lot of jowling that has come up, a lot of bands in the neck, or the lines have become really deep and saggy, then yes, then they definitely should think of surgery first, and then in fact after the surgery they may do HIFU for maintenance later on.
So in facelift surgery, there's always a concern of overdone. Like patients feel as if
Yeah.
they look very overstretched. The skin will look overstretched after
Correct.
surgery.
Yeah,
So how do you solve this problem?
So it also depends on the technique of facelifting which has been employed. Like if someone is doing something like a max lift or a skin kind of procedure, then you really need to pull the skin too tightly in order to get a visible change, and that's when the wind tunnel deformity, or this kind of tightening effect is called as wind tunnel. That happens because of over pulling on the skin. When we do something like a deep plane facelift, there are ligaments in our face which are tethering the skin to the deeper structures, and these ligaments are released uh, while doing a deep plane facelift. So the tissues automatically move to the correct location. So the chance of a wind tunnel deformity, or the face looking too much tight or too done up, doesn't happen with a deep plane. It looks very, very natural. Because when we do the skin closure in a deep plane facelift, there is absolutely no tension on the skin. We just keep the skin where it is and remove the excess skin.
So recovery time is a big factor for many patients.
Yeah.
So how long does someone has to take a break after the surgery?
I would say 10 days to 15 days is when they can really, they have to be at home. They can't really go out or meet people socially for a period of 12 to 15 days. After 10-12 day period or 15-day period, they can leave their hair along the sideburn areas, and they can start going out. So the changes are not that visible to people after that period. If of course you combine eyelid surgery with the facelift, then eyelid skin is very, very thin, and eyelid skin in fact tends to be swollen for more number of days than the face and the neck. I find face never has any swelling. Neck, sometimes in the lower part of the neck you may have swelling and bruising up to 2 weeks. Eyelids can take up to a month.
And some patients are scared of the surgical risk.
Yeah.
So how do you address to their concerns and worries?
I mean, see, I always call it the fear of unknown. Okay, if you are going to sit in an aircraft for the first time, and you are of course going to feel scared. So it is human for all of us to be scared of a procedure. I mean, lying down on the operation table is not something everyone does during the course of their daily routine. So it is definitely something that sounds intimidating to people, but I try to explain to them. I walk them through the process, that you'll be coming in the morning, we'll do all markings for you, then you can see those markings in the mirror, and then there is IV given to you. So I guide them through the process of how it is actually going to happen on the day of the surgery, so that sometimes eases their mind. And of course, I sometimes tell patients not to see too many surgical videos online.
Yeah.
The main problem with
They keep on
patients is
Googling.
that they keep seeing surgical videos, and that's what makes them feel scared. Sometimes you just need to trust the doctor and trust the process, and not try to over analyze or not overthink into what the procedure is going to do, because that doesn't really help.
Right. So what about the cost? How is the cost like HIFU versus facelift?
So HIFU, the cost is something which ranges between say 20,000 to 35,000, depending on the areas and how it is. And it's very difficult to give a cost for a facelift because it's a surgery which is customizable. It depends on whether a person needs only the face, whether you need the neck along with the face, whether you need a platysma tightening along with the neck, whether you need eyelids to be done, whether you need fat grafting to be done. So putting a price range on a facelift is difficult, but the range is from, you can say, 1 lakh 50 to 2 lakh onwards.
And so where do you see the future of skin tightening and lifting procedures now? HIFU, can a technology like HIFU ever replace surgery?
No, I don't think a technology like HIFU can replace surgery per se, but the trend world over is to go towards minimally invasive procedures. So something like Dr. Kao, who's doing the ponytail facelift. So that is something which is very interesting. He's actually doing a deep plane facelift using very small concealed incisions. So when we are able to have more advancements in endoscopy, probably an endoscopic facelift is the surgical option of choice that will happen. Of course, lifting the tissues itself is not going to suffice. You also need to be able to work on the skin. So probably for skin rejuvenation, it will be non-surgical modalities, and for the actual lift, it will be surgical. That is what I feel.
If you are in your 30s wanting to look like in your 20s, you can actually go in for treatments like HIFU. And if you are someone in your 50s and wanting to look like a 20-year-old, you can actually opt for a surgery like facelift.
Yeah, that's the correct way.